too. Don't. It was awful, dreadful illness. Right, I'm going to say a big hello from me. So for those of you I've not met, I'm Claire Rogers, and so I'm the GP Nurse Professional Development Lead for the Training Hub. So massive welcome to the Care Engagement event today. Very, very exciting thing for Northamptonshire, and I'm really glad that you could join us on this beautiful sunny day. I hope I'm very aware that it might be people's lunch break, so I hope you've got a sandwich and a cuppa if it is your lunch break that you can enjoy. So the point of this session really is to give you some info about the care programme. Very much encourage you to sign up because it sounds brilliant. And you're going to hear a lot more about it from the care team and also from previous attendees. So it's been up and running for a little while now across other systems, and we feel very privileged actually to have some funding from NHS England to be able to deliver it here in Northamptonshire. So it's very, very exciting. So I'm going to hand over actually to the guys from the care team, who I have no doubt will introduce themselves to you. And yeah, over to you guys. Thank you so much.
Thanks, Claire. Now, as I'm talking, I can see people now. Teams is doing a very weird thing today, because a minute ago I was just looking at a black screen, Claire, but could hear you, so that was a relief. But I'm Cheryl Mackay, I'm part of the care faculty, and I'm here today with my colleague Faye Hames, who I'm sure will introduce herself in a minute, and my colleague Rachel, who is also doing our tech for us today, who's part of the care faculty team as well. So if I can have our first slide, please. So just for those of you that don't know who NAPC are, so the National Association of Primary Care is a not-for-profit organisation, and we support primary care, but also work, I guess, at ICS and place level, bringing about population health improvement for their populations, trying to reduce health inequalities, but also really trying to improve and help improve, I guess, that work-life balance for colleagues in primary care. So we take a very OD approach to what we do, and we have a faculty of some 60 plus, and it's part of our faculty that deliver the care programme. So the care programme is kind of brought to you, if you like, as it's a partnership between NAPC, Bedford, Luton and Milton Keynes, who actually, the programme really came out of some work they were doing there. So it was founded on what, actually it started with GPNs, but what nurses really needed to help their leadership journey. And they are still partners in terms of delivering the programme, and NHS England, who commission it and unfortunately fund it for lots of systems. So as Claire's already alluded to, I'm going to give you a bit of background. Then we'll be hearing, Faye will be interviewing one of the former alumni from the care programme. And to be honest, if that doesn't sell you wanting to join the programme, then I don't know what will. But then we'll hear back from Claire, and then there'll be a chance for a bit of Q&A. But again, please just post questions for us in the chat as we go through and talk about it. So as I said, I'm Cheryl Mackay, and I'm part of the faculty, and I am a nurse by background, although I haven't sort of inhabited that world of clinical practice for a long time. But quite a lot of our faculty are nurses, GPs, but also actually sometimes we've now got people part of the faculty that have been through the programme that have now joined the faculty. But what I would say about the faculty and the programme is it's delivered by people that have worked in or around primary care for a number of years. So we do bring a real flavour into the programme of what it's like to work in primary care. Now, the programme has evolved. We don't just now teach to GPNs. I know in lots of different systems we are delivering this now for all healthcare professionals that work within primary care. So next slide, please. So what is care? It's a leadership programme, and the part of the programme is there are three really key cornerstones of what the care programme is all about. One of them and I would say I'm going to start there, is to do with your resilience and well-being. So there's a big NLP element, which is about developing you as individuals, but also giving you some tools that help you become more resilient individuals within your workplace. But also, we bring more of ourselves to work than just a professional person. We're not robots, so it also helps develop you as a human being outside of that, and helps with some of that resilience. Another cornerstone of it is population health. We exist really it's all about population health improvement and tackling those health inequalities that exist within our system. So a lot of what we go through on the programme will give you some of the tools and techniques to start bringing about some of that change. And what we often find is people are already doing this. It just gives you a language that you can pin some of this on. And it's also about helping you have that leadership system impact. And again, a lot of you already probably do this, but some of it, coming back to that resilience and well-being, is actually helping you believe in yourselves and believe in your ability. And across the bottom, the programme is made up of the words connected, authentic, resilient, and empowered. And this is all about giving you a voice. And as I said, a lot of you will already have a voice. A lot of it is sometimes that self-belief. But what we really do promote throughout the programme is building on some of that as we go through. Next slide, please. So the programme, we start off with this engagement event. We then deliver 8 virtual modules. And then usually a couple of months after we've delivered the programme, we'll have a celebration event. I have to say, I absolutely love celebration events. It's so wonderful to come back to cohorts and systems that we've worked with and really hear and see about what they've continued to do since the journey from undertaking the programme to that event. We then take you through aftercare. And I'll ask Faye to step in and tell you a little bit about that in a minute. And that aftercare engagement event is very much led by you about what you want. And then we go into something called aftercare. So that's the programme in a nutshell. But to get more into actually what the modules are, if I can have the next slide, please. So as I said, we have 8 modules. And the modules in blue are all the population health improvement modules, and the modules in that sort of greeny colour are all the sort of resilience and wellbeing sessions, and they are founded on the NLP framework. So for those of you that don't know NLP, it's neuro-linguistic programming, and we give you some really neat tools and techniques to help you in those sessions. So all of the modules, each of them starts with, well, in every module, there's a little bit of theoretical content, and we tend to keep that fairly light. We also have a workbook that accompanies the programme that has further reading, but also some pre-reading that we do suggest participants have a look at. We've kept it light. We know you're busy, but it just helps you landing the session with having done a little bit of pre-reading. So the population health improvement sessions really help you think about particular projects that you might want to work on. And we really encourage anybody that's going through the programme to take on board a population health improvement project. It's not mandatory, can't make you do it. But what we find is that everybody that's been through the programme have found it really beneficial to do something, however small, because it helps you translate what we're discussing and take that theory and put it into practice. So it helps with that learning. But it also gives you some of that language, that framework in order to help you with that. And for people that are often already doing projects, all it is that they've brought that project into the programme. And what we do is help you think about sometimes how are you measuring that particular improvement that you're working on? How are you going to evidence that impact? So again, we can help you with some of that. As I said, it's not mandatory. Some people only start with 1 patient. Some people don't start their projects until the end of the programme, but that's really up to you. So the NLP sessions, as I said, very much focus on you. And what we do as we go through the program is we build on the content week on week. So then the NLP isn't sort of a standalone thing that doesn't translate back into practice. We start getting you to think about yourself, the state that you're in, how you can control your state in relation to how you engage and be that distributed leader within your own systems. So as I said, the program, each module is 2 hours long and is delivered virtually. But what we do through those sessions, as well as that theoretical content element that we give, we also use breakouts a lot. And in every session, we do at least 3 breakouts, because the most important thing is enabling people to come together and talk about some of what we've talked about and relate that back to practice and share, actually, because you actually have so much wisdom and experience. And what we're trying to do is just give you the opportunity to share and develop your voice with each other around some of that. If I can have the next slide, please. We'll just play this video if we can. Quick video from Dr. Johnny Marshall.
NHS England's long-term plan signals a real focus on improving population health, where population health is defined as improving people's and communities' health and well-being based on what's important to them, and addressing health inequality within those communities. GPNs, with their natural skill set, are extremely well placed both to shape and deliver new services that really address this challenge. And yet we're aware that GPNs are feeling undervalued, where there are challenges with recruitment and retention. And therefore, as part of NHS England's commitment and aims and objectives in the GPN 10-point plan, NHS England has commissioned the CARE programme, which is designed to improve the resilience of individual GPNs, to help them understand how they can bring about service changes that improve population health, and to give them the ability to make that change within the organisations they work for. In order to adopt a successful focus on population health management in terms of looking at people's wider sense of health and well-being based on what's important to them, we first need to remember that only 10 to 15% of that sense of well-being comes from healthcare activity. The vast majority comes from wider determinants of health, such as lifestyle, employment, housing, and relationships, things like that. So it's really important when designing better care and support that we've got a real focus on the needs of people and communities, what's really important to them, to help us understand how we can activate them and work with the partners around us to really create more joined up care and support that really taps into this sense of what's important to people, what's important to communities. And this is something that the CARE programme will help you to understand and help you to go on and deliver within your communities. In order to improve population health, NHS England is creating integrated care systems that will bring together partners in geographical boundaries who work together around improving the health and well-being of the populations that they serve based on what's important to them, and reducing health inequality within their communities. The reality is that health and care systems are rarely, if ever, built from the top downwards, but they are based on one-to-one interactions between individual people, families, carers, and prepared, proactive, professional primary care teams. And therefore, it's going to be the role of everyone in a primary care team to help bring about the necessary improvements in care and support, working in partnership with their communities and other partners in the health and care sector, if we're really going to bring about a fundamental change in the improvement of population health. And the CARE programme applies as equally to general practice nurses as it does to any other member of the primary care team, and can really equip primary care teams in any ICS in having a united workforce working together around a common purpose to improve the health of the population, its well-being based on what's important to them, and to reduce health inequality within our communities.
Thank you to Johnny. So last slide then from me, and then I'll hand over to Faye, who can just tell you a very quick little bit about aftercare as well, just before she takes us through a celebrity interview. But one thing I love about the care programme, and I find really special, is some of these comments. And Faye and I have been delivering on a care programme this morning, and I was working with a group in my breakout who are struggling at the moment because of the pressures of primary care and just how tough it is out there. But one of them said to me that, and she's somebody that is also doing her ANP masters at the moment, so on top of being a busy mum of 2 and doing a master's degree and coping with the life as a GP and currently working in primary care, she said to me, however tough it is, I love my Wednesdays. And it was her day off today. She was there on her day off for the session. She said, this programme has been amazing and life-changing. She said, I'm having conversations that I never thought possible with people. I'm starting to believe in myself more. And whereas before I may have just shut up and got on with something, I'm learning to have a voice and say something, but saying it in the right way. And Faye and I, who support groups go through the programme, really see this change. And in celebration events, time and time again, I hear about, actually, for some, even though this sometimes feels like shoehorning 2 hours into an already busy week, for them, it's their happy place they come to, because actually they learn something, but they have that opportunity to share and learn together with other people and like-minded people. So I just wanted to share that with you. So I'm going to hand over now to Faye, who will tell you a little bit about aftercare before she interviews one of our wonderful alumni.
Okay, thank you, Cheryl. And thanks for inviting us today. It's really great to see so many people here. So I'm Faye Hames. I work for the NAPC. And when I'm not working for the NAPC, I have previously been a primary care network manager and now cover 3 primary care networks down in Thanet in Kent. But I grew up not far from Northamptonshire, not far from Daventry, so I kind of know some of the area. So some of the titles are quite familiar to me. So it's good to be part of your group today. So I am a nurse by background, and my background really is palliative care, end-of-life care. I've worked in various hospices across the Midlands, actually, before I moved down to Kent. And I've been involved in the NAPC for many years, but only fairly recently with the care programme. And it's amazing to see how nurses and healthcare professionals that have joined the programme have really changed and developed their skill set, and we give them different tools to be able to help them in different situations that they might find themselves in. And part of the programme, as Cheryl's already alluded to, is about the aftercare support that we provide. And the aftercare support can be one-to-one support if you need that, but also the aftercare is about supporting you with your projects. And although they're not mandatory, most people that join the programme actually take up a project. They've got something they'd like to develop. And myself and a gentleman called Jag, who is a real guru with data and analysing data. He's really excellent. He actually can support us. And what we'll do is we can support you with your aftercare projects, look at how we can measure them so they have an impact. And we've had over 300 people go through the programme, and we've got all sorts of projects, from developing elements on a website to asthma clinics for children to diabetic reviews, all sorts of areas of work really that we can support you with. And so that work is there for you to take hold of really, and kind of make the most of the programme, make the most of the resources that we can offer you. And we do that in collaboration obviously with the Education Hub. So it's really great to be here, and we're, you know, the team is made up of lots of people, and we're there to help. So I'm going to introduce you to a colleague who joined the group a little while ago from Nottinghamshire. Her name's Anna Davis. I'm sure she's on the call at the minute. So welcome, Anna, really good to see you. And Anna is a practice nurse lead and a nurse prescriber within Nottinghamshire. And the project focuses on leg ulcers and Dopplers. And I'm just going to ask her a few questions just to give you a flavour of kind of what the programme's about. So Anna, if you're ready to go, we'll make a start. Is that okay?
Yes.
Great. Okay. So Anna, can you tell us why you were interested in your project idea around leg ulcers and Dopplers?
So is it all right if I tell just a little bit about myself first? Because I think it'll put into context, really.
Yeah. Absolutely.
So just to say that I was part of the pilot in Nottingham. So all those quotes that you saw a minute ago, that was none of them are me, but that's my cohort that I was with. I was practice nurse at the time, and I was going to, I've been asked to take up, you know, the care programme that looked really exciting, etc. But the time I was about to start my prescribing, and I thought, oh, they're never going to let me do this in my practice. But there's not, I've been a practice nurse for 4.5 years, and I thought, we never get these opportunities. I've never seen anything like this. You get asked immunisations and about diabetes, etc. But I've never seen a programme that looks this exciting. So in the end, I went and asked. My practice manager said, yes, I think it'd be really good for you. So I went on the course, and it really is amazing, and it's so life-changing that I am now actually the lead practice nurse across Nottinghamshire, which I really wasn't at the time. So in terms of the project and kind of how that came about, so we had our care programme through kind of the height of COVID, really. So it was all a little bit stressful in terms of sort of projects and things when everything was up in the air. But part of our cohort, we didn't just have general practice nurses. We had nurses from the community. We had nurses from care homes, etc. as well, and that range was really good, especially the breakout rooms and hearing other people and making connections there. But we had a session, like a post-care session, and we were discussing about wound care, and within a conversation it came up that you know, we were saying, well, we've got to wait 6 weeks before we can refer to the leg ulcer clinic, and a community nurse said it's actually 2, and it's been 2 for a number of years, and we didn't know this. So there was a primary care network that were particularly interested in looking at wound care that asked us, could we develop this a little bit more? So through those connections, we then did some work to move this forward, and not just looking at, you know, referrals, etc., but looking at the wider picture of what a practice nurse could do in health and well-being, etc. But this project's actually, it's really taken off, and this I've now actually haven't out. I was just in the place, and it's amazing the places where things take you, and it is the connections. And I'm actually leading a project across the whole of Nottinghamshire ICS, looking at pathways for patients with leg ulcers right into secondary care. So we're having meetings with vascular surgeons, etc. And the people there are saying this, you know, for us and for our patients, and, you know, for me in my career, this is absolutely life-changing. And that I can talk directly to a vascular surgeon. I can just ask them questions, and they want to support, etc. as well. And this morning I was having a conversation with the contracts person for the CCG, because we're in the process of changing a contract. So things that I never thought in a million years as a clinical nurse that I'd end up doing. But that is, people really welcome you. They welcome your skills. So it's having that belief and just connecting with people, and it's amazing how many people want to talk to you, I would say.
That's amazing. It's really great to see, actually, Anna. It's really my background actually as well is lymphedema care, so I'm really interested in the wound element. It's fantastic the work that you've done, so that's great. It's really great to hear. And what were your thoughts about embarking on the programme initially?
So I really wanted to do it because I've been in secondary care for 16 years, and I had done bits and bobs of things like this. But since I'd been in primary care, so it was almost like task-based things, and nobody had ever looked outside the box in that way. And you know, when I saw that we'd got, you know, the lead nurse across the ICS that was coming along, and somebody else was coming along to support the programme. I've always been interested in population health, so I just thought, well, I can't let this go by, because if nobody signs up, they're not going to offer it again, are they? And what shame would that be?
Yeah, well, that's
So
great.
yeah,
Yeah, lovely.
I just went for it in the end.
Yeah, good for you. That's great. What were, if you had any, were any of the obstacles and barriers that you faced along the way in developing your project?
I think I don't really, in a way, there hasn't been huge amounts, because it was more that it was more finding people. But then I find that, you know, there's always one person that says, oh, I'll introduce you to.
Yeah.
And if they don't know, they're like, well, we'll introduce you to. And I just found that everybody was helping me because they believed in it. So it was more the barriers that I was perhaps putting upon myself, that nobody's going to want to hear about this, nobody's going to want to do, but actually do. I think that's been the biggest surprise, really, is how much other people want practice nurses and are supporting practice nurses. It is the belief that we perhaps don't have for ourselves.
And I think that's the thread that goes through the whole programme, really, isn't it? It's about believing that you can make change and you can deliver a change. And you've kind of alluded to that. So that's really excellent to hear. Thank you. And you've already mentioned some of the key successes, but what were the key successes for you? Not just about the project, but you personally, what were the successes?
Yeah, it's definitely the wellbeing things. And I would say they're things that, so it's about 18 months ago since I did it, and there's still things that every single day that I think about. There are things that you think, why don't they mention this at school, or how did I get to this age without mentioning? And one thing was particularly I'm not a complete control freak, but I do like to be in control of things. I think you have to be, you know, 10-minute appointments. You've got to have some sort of control. But and it was that you're not in control of everything, but you're in control of how you respond. And when somebody said that, and I just thought, oh my goodness, that's so true. And why didn't I know this? Why is it not a GCSE? Why is it not? and the other thing was about is the circle of concern, and starting small, and say this was just a small project, and you know, if I'd gone, right, I'm going to change the pathway for the whole of Nottinghamshire, nothing would have happened. And I never thought of it like that. And it was just something that we've just, you know, wanted to look at something fairly small, and then it got bigger. But so yeah, those sort of bite-sized chunks, definitely.
Yeah. And I think the other thing that we talk about, and you'll probably remember this, Anna, is the you know, think big, start small. And actually you're kind of reflecting that's what's happened with you, and it's amazing to see. So yeah, well done, it's great. And what have you learned about yourself in particular through this experience?
Yeah, I think just it's that belief, and it's that I'm very much, you know, if I go knocking on somebody's door, I'm timidly knocking on the door, and thinking, oh, nobody's got time for me, nobody wants to know, etc. But actually it isn't like that. But something that I think Johnny did a session for us, and it was about finding people that are influential, that can connect, that want to be, that are interested in the same sort of things, and being around them, really, and because they're the people that help you to then find other people, or find people that may be slightly trickier to get over, and win over, etc. So yeah, I think it's that belief.
Yeah, brilliant, thank you. And the last question for me is, if you could give one tip to the people on the call here today, what would it be?
I would say, honestly, just go for it. And say I hesitated, but it's more because I thought, oh, my practice manager will never let me do that. But if you don't ask, you don't get anywhere. And yeah, I did some on my days off. I did some during my admin time, so a real mixture of things. But I just went and had a conversation, and yeah, I mean, it's been amazing, to be honest.
Great, thank you, Anna. Thanks so much for sharing your experiences and your project. It's really lovely to hear, and lovely to see how it started small and it's got much bigger, and your role has changed as well as a result. So congratulations, it's really good, and thank you for coming today and spending the time with us. Really appreciate it.
Thank you.
Thanks, Anna.
I'm just conscious, Claire. I think everybody's cameras and mics are disabled in the meeting, so I've encouraged people to post in chat if they've got any questions. But in the meantime, shall I hand back to you, Claire, and then you can just talk through why you think it's a good opportunity for your systems to have the care programme?
Yeah, absolutely. I would just say, Craig, I don't know if you're still on the call. If you are, I think Craig's got the button that can unmute everybody. So if you are, Craig, if you could do that, fab. If not, we'll use the chat box. Massive thank you.
Sorry, I was just literally typing a message in to ask if you wanted me to activate them. So.
Yeah, that would be fab. If you activate them, and then we can do Q&As in a minute. Thanks, Craig. Huge thank you, Anna, for coming on to talk about your experience. Huge thank you to all of you, actually, but to Anna in particular, because as you say, it's the people that have done it that are the people that can really tell us the benefits. I would say, from my point of view, so the reason that I think it's a great idea, and the reason that I've kind of a big advocate of it, is that I was doing a bit of research. I was new in post back in the autumn last year, and I was thinking, right, what have we got? What can we do? What can we offer our staff? And came across the care programme, had a fabulous meeting with the team. I thought, yeah, this is absolutely brilliant. I've got a background in quality improvement, and we all know there's lots of evidence that actually if we've got happy patients, we've got happy staff, and vice versa. So if we're doing something that improves staff wellbeing and improve stuff for patients, it's got to be a winner. So I was very, very excited about it. But at that point, there wasn't any funding. So I just had to kind of park it away and hope and pray. And then at the beginning of the year, we got the news that we got funding. So I was over the moon about that. As for a system, it's a great opportunity that we've got this funding from NHS England. And I think I'm very keen to promote the fact that this is for anybody now. So it started off for GP nurses. This is for anybody working in primary care now. Anybody who thinks that this programme sounds good, which it clearly does, wants to improve their wellbeing and resilience and wants to improve things for their patients. To me, it's an absolute no-brainer. And there's some great work come out of it. I would encourage, we've got a page on our website with lots of information that links to the care website as well, and there's lots of other testimonials on there. There's lots of little video clips of other projects, and I guess I would kind of stress, and I'm sure you guys would back me up on this, is that this is not an arduous thing. A project sometimes instills a bit of, oh my goodness, that there's reams of work. This is stuff that you guys will be doing every day already. You'll be thinking, oh, actually, how can we streamline this a little bit, or how do we improve that? And you're not calling it a project, you're just doing your job. And actually, the project part of it is having the support so that you can evidence the impact that you're making, because actually that's important. The GP practices are businesses, and it's important that you can evidence the impact you're having on the patient health, but also the impact that you're having on the business. And lots of quality improvement projects have a positive impact on business as well. They make things streamlined. They make you work more efficiently and effectively. So it's a kind of winner all round for everybody. So that's certainly why I would advocate this. And I really hope that you feel the same after listening to this today. So I would encourage, if you've got any questions, it looks like I think you can probably all unmute and stuff if you want to now. So if you've got any questions, please do pop your hand up or pop it in the chat, either or. But yeah, it is for anybody working in primary care. So I know we've got lots of different job roles interested. I know that there have been admin staff, practice managers. You are all very welcome. But yeah, any questions, please do pop them in now for us.
I was just going to add something, Claire, if I may. One is that if anybody is not sure and wants a further discussion, I know Rachel's going to post our email address in the chat so that people can reach out, and we'll always be happy to have another conversation. But the other thing I would say is the groups that we do have who are both running or finished, where we've had people from across primary care, not just GPNs, have been amazing to work with. Just, I think the level of sharing, the diversity in projects that people are working on, and the different mindsets that we bring. You know, at the end of the day, you know, we are a primary care team, and actually it's really great to actually work across those sometimes professional boundaries and learn and understand from each other. So that's really brought a really fabulous, I think, dimension to the care programme. And we've had everybody from reception staff to GPs in some of our sessions, to paramedics, to practice managers, to social prescribing link workers, and I've probably missed people off that group, physiotherapists, OTs, and it's just amazing.
Yeah,
it really is amazing.
Yeah, fabulous. I've seen, so Craig has popped in the chat for you there. So this is the website page that's got all the information on there, and this is where I think there's lots of people that have signed up already. I believe we've got 8 that have signed up, registered for the programme. But after listening today, if there are more of you that would like to sign up, just click on the link there in the chat, and that will take you through. It gives you the little box at the bottom to click and pop all your details in to register for it. The dates are all on there. It starts in June, so it's on a Wednesday afternoon, running from June through to September. But everything is on the web page that you might possibly need. So now it looks like there's no questions popped in the chat, and nobody's got their hand up. So unless there's anything last minute, I think we could probably wrap it up. No, everyone's really quiet. We needn't have unmuted you. Thank you so much, everybody, for attending, and thank you guys for coming along and presenting as well, and you, Anna, sharing your experiences. It's really, really helpful. Yeah, so pop us any questions that you might have. Oh, thank you. Thank you, Lisa. Yeah, so pop us any questions you might have via you can contact Care directly. You can contact us via the website. You've got all the details there. Oh, we've got some comments. Really useful. Thank you. Looks like a great programme. Lovely. Well, thank you all for joining us on this lovely day, and we'll see you all soon.
Thanks, everybody. Take care.
Take care. Bye-bye.
Bye.
Bye.
To let you know, I will post the video up on that web page as well. So if you need to show it to anybody, discuss it in your practices, that's where you'll be able to access it from. Thanks.
Thank you.
Thanks, Craig.
Okay. Bye, ladies.
See you later. Bye.
Bye. Bye.